Well, everybody, right now, I would like to introduce you to Dr. Mary Zupecht, and alongside of her is Lisa Robenall, and we are going to talk about infantile spasms, all right? And everybody's going, what are you talking about? But this is happening, and Dr. Zupecht, could you please share with us what this is? What in how many children does this spasms affect?
Well, infantile spasms is a subtle seizure manifestation. It is a form of epilepsy and can have catastrophic consequences in infants because their brain is still developing. But as opposed to what you see on television, which are generalized tonic-clonic seizures, where someone will fall and have rhythmic jerking of the arms and legs, infantile spasms are much more subtle. That doesn't make them inconsequential. It just means that they're difficult sometimes to detect. They occur in the early morning hours as a child's awakening from sleep, or sometimes when they're falling asleep. But they can be very subtle episodes of simply the eyes rolling up, shoulder shrugs, flexion of the midsection that occur every 1 to 5 seconds over a span of 5 minutes, sometimes lasting 30+ minutes.
Okay, and what age group are we speaking when you say infants? I mean, 6 months old, older?
No, it typically occurs between, there's a range, between 2 to 8 months of age, sometimes up to a year of age.
Okay.
It occurs in children that may not be able to verbalize or tell parents what's wrong. So that's why, and because it's so subtle, the parents notice the changes, but other people, even I think Lisa can attest to this, even parents and grandparents may not initially see the signs or symptoms of infantile spasms.
Okay, Lisa, well, how did you find out your child had it?
Yeah, so thanks for having us. I started to notice when she would wake up from naps that her eyes would roll in a subtle, systematic way up and to the left. And the first time I saw it, I actually had a physical response. And I cried, and I asked my husband to look, and he didn't really notice it. And I took her to our pediatrician, and she wasn't doing it at the time, but he said, you know, babies just do kind of strange stuff. And so I looked to the internet, which is one of our recommendations, to, you know, see the signs, look at what other people have found, and other parents were encouraging me in their own way to take a video and to seek out a neurologist. And so ultimately, we were able to find a neurologist and do an EEG, the test where they glue all the electrodes to their head.
Yeah.
And that was how we were able to confirm the infantile spasms.
Okay, but can it be controlled? Can this be controlled?
Well, I think that in Infantile Spasms Awareness Week, we use the mnemonic: stop, see the signs, take a video, obtain a diagnosis, and prioritize treatment. The earlier we can make the diagnosis, for myself as a pediatric neurologist, the earlier I see a child with infantile spasms, I get them into the hospital. I typically do a long-term or prolonged EEG that will confirm the diagnosis, and we initiate treatment immediately. If we can make that diagnosis and start treatment within 4 to 6 weeks after the onset, the better the outcome for the child.
Absolutely right. Right. So it's a response, and parents having infants, please watch them when they're sleeping. You don't, is that a suggestion? You just don't put a baby down and walk out of the room. You need to watch and see what's going on.
Well, sometimes they don't occur they don't occur during sleep. Babies will have what we call myoclonic subtle jerks during sleep that aren't infantile spasms. Infantile spasms typically occur as a child is awakening in the morning. And because they occur repetitively, like in Lisa's daughter, and last between 5 to 30 minutes. It's something that parents usually recognize, and it's atypical, and they know it.
All right, now.
But what often happens...
Our time is about up. We're going to be off the air here in a few seconds. What website do you want people to go to get more information?
Yeah, so isweek.org would be a great resource for them. And if families are wondering, or if physicians are wondering if their patient might have this, isweek.org is a great starting point.
And STOP, doctor, can you please give us what STOP stands for?
S is see the signs. T, take a video. O, obtain a diagnosis. P, prioritize treatment.
Well,
and if I could mention one other thing, there is a trial for patients with tuberous sclerosis called PREVENT.
Okay, we're going to be cut off the air here. I thank you. I'm so sorry. I'm so sorry. Everybody, thank you so much for being with us. Oh.